Hi, Daryl Combs here. Are you on Wikisana?
Seid ihr auf Wikisana?
Welcome, dear viewers, to today's natural medicine format with the topic of POTS. You'll see who my exciting guest is today right after the intro, so be sure to stay tuned. See you soon. Yes, welcome back and welcome, dear Harald Burgard. You are a specialist in medicine and clinical environmental medicine.
That's right, yes. Good morning, hello.
Good morning. Good to see you. Yes, I've never heard of POTS like that before. I typed in the term once. What comes up pretty quickly is that people just fall over. Can you explain to me what POTS are, or what they are?
Yes, it's a condition that not so many people know about, but 1 or 2 people suffer from it, but perhaps can't put their finger on it. POTS has the complicated name of postural orthostatic tachycardia syndrome. This means that the moment people stand or sit upright, their circulation becomes weak. It partially collapses. Then, of course, the heart rate goes up, and they don't know what's happening to them. That can happen when you are shopping. You suddenly fall over. It can happen when you're in the car, sitting in the car. Your circulation collapses. And the danger is, of course, that you injure yourself, that you become anxious because you simply can't judge what's going on. And the special thing about the disease is that it's not a circulatory weakness as we normally know it, in which a ventricular tachycardia or something like that occurs. It comes out of nowhere, and often nothing is found. It happens, for example, also after viral diseases. It happens when certain substances are produced in the body after other interventions. And in the last 3 years, the disease has become relatively more common. I have treated some patients with it, and they come and are extremely frightened because they simply can't find any help. Because nobody knows where it comes from. And if you don't know where something comes from, there's little you can do. And what we now know is that this is a disorder of the autonomic nervous system. This is something we all know, the sympathetic and parasympathetic nervous system, which controls flight and relaxation reactions. It controls your organs. It controls vasoconstriction and vasodilation. And that is disturbed. And when that is disturbed, then the heart rate goes up. And when you read about at least 30 beats, that's quite a lot. So if someone has a heart rate of 70, it suddenly goes up to 100, and you can tell. But it also has to do with the fact that in many cases, the blood pressure simply collapses. And then it says pre-syncope. Syncope means that you either briefly lose consciousness or simply fall over. So you sort of lose normal control. This can occur in different degrees. Anything can happen, right up to a brief loss of consciousness. Then, of course, palpitations. People get dizzy. Afterwards, they are feeling weak afterwards. Sometimes they also feel nauseous, headaches. They get shaky. Brain fog means they feel foggy in the head and can no longer think properly. Their concentration is disturbed. And of course, it also causes anxiety. Can you imagine going shopping and suddenly falling over? That's no fun. And if nobody finds out what's going on, and you have to worry about it again and again, it's a disaster.
Yes, I imagine it would be extremely bad if I always had to live with the fear that no matter what I do, I could just fall over immediately. I wouldn't feel comfortable being at home on my own, let alone going out on my own.
Yes, absolutely.
Are there special triggers, let's say bright light, noise, or something? Does it just come on, no matter what the situation?
It really does come out of nowhere, and that's the big problem. It usually doesn't even announce itself. When things announce themselves, you get a migraine with an aura. Then, you know, okay, now I'm going to get a flickering in front of my eyes. Now I have to lie down somehow, darken, or take a tablet, and so on. Then I can prevent it. But this comes like a bolt of lightning and bang. And if you then react harshly and simply fall over somewhere, then of course there's a great risk of injury, the risk of accidents when driving or whatever. And what's even worse is that we haven't been able to recognize this in conventional medicine, and we haven't been able to treat it. And we have hereafter, it occurs after infections, post-acute, So it can occur suddenly, but it can also occur after a delay. It can also last for months. It can also last for years. I've had patients who had to deal with it for a year and a half before they came to us, and we were able to do something about it. And we often find this together with fatigue disorder, chronic fatigue, or panic disorder, whereby the question is always, where do they come from? Is this then more the consequence of this reaction, or is it a contributory cause? We don't know exactly. But if you look at the figures, 170,000 patients in Germany alone are known to have it, not including the probably much higher number of unreported cases of people walking around who don't even know they have it, or who don't even know they have it. They just blame it on something and say, oh, you're unwell, and whatever. Or they say, well, you've had something, you'll be fine, when it's not even diagnosed.
Of course, that's a lot. Has this somehow increased over the last few years, or has it been a well-known issue for some time?
So we've known this for a long time. But it has, of course, become much more severe in the last 3 years due to this post-viral infection that many people have when they fall ill again after falling ill. That has been relatively tight the last years. And then the immune system naturally becomes quite deranged. Special autoimmune antibodies develop that disrupt the autonomic nervous system. And if there are disturbances in the nervous system, this always affects a whole range of messenger substances, which then react to nerves, adrenaline, dopamine, and so on. If these substances are disrupted, anything can happen in the body. Or when inflammatory substances are produced, interleukins, tumors, Negros factor alpha are always produced. Hormonal imbalances occur. So these are complex things that happen. And this is actually a multi-system disease. It's a clinical picture that doesn't just briefly open up the blood vessels or something like that, but really affects the nervous system, the immune system, and the hormone system. And these are organ systems that are very closely interlinked. And then there's the mood. Then you get anxious. When you panic, as they say, you get brain fog. The immune system also reacts. Then, of course, pathogens can also go up if the immune system is weakened. It's a relatively complex disease that can unfortunately have very, very unpleasant effects.
Yes, very complex connections of this disease. And how can you diagnose it?
Yes. First of all, you listen to what the patient says. I always carry out laboratory analyses. Of course, I look for antibodies. I look for inflammatory messengers. I look at what viruses are active in the body. Herpes viruses, whatever. The medical history is important. When did it develop? How did it start? So all these things that we also diagnose with other chronic illnesses, with chronic fatigue, etc., we also have to diagnose them here. And once you know that, I know how I can help the patient. And there are general measures, if you have something like that everyone who has to deal with it should know, that you say, okay, watch out, stand up slowly. We know about orthostatic dysregulation, or orthostatic dysregulation in older people. It's often seen in older people, stands up and gets dizzy. Why? Because the blood vessels, especially in the legs are no longer as elastic. Normally, when we stand up, the blood first sinks into our legs, but the blood vessels close quickly so that it doesn't sink down and is then missing in the brain. Only in older people, where the vessels are a little stiffer, does this not happen. They stand up, the vessels do not close, blood sinks into the body, is missing up there, and then they get dizzy, or they fall over. That has nothing to do with this disease, but the symptoms are similar. That's why they're told to stand up slowly when they're sitting or lying down, so that this doesn't happen. Also, avoid standing for long periods. We also know this from older people. We know that here too. If you stand for a long time, suddenly the pressure drops, and then you're getting dizzy. Especially on hot days, of course. The blood vessels are even more open on hot days, and then you can get into this situation even faster. Drinking enough is important to ensure that there is enough fluid in the vascular system, because if there is not enough fluid in the vascular system, the blood pressure naturally drops even more and can then lead that. Eating enough salt so that water is also bound. Sodium chloride is salt. Sodium binds water. Yes, and exercise as much as possible. Endurance training to train the blood vessels. But these are general measures that never really make POTS go away. At least, that's what we've learned. Compression stockings, yes. The idea is to force the blood vessels not to open up so much by increasing the pressure from the outside so that the blood doesn't sink so fast. Then, of course, avoid alcohol and heavy meals, preferably several small ones. Possibly then diuretics, water tablets that you reduce, and of course a consultation with the doctor to keep the fluid volume in the blood system high, and possibly medication that works on it, beta blockers, melatonin, and so on. These are all things that can lower blood pressure. But these are general measures that are also taken by older people with autostatic dysregulation syndrome. However, these are not measures that really work in real POTS and prevent it from happening to you.
Then let's go straight into the treatment of the causes.
Yes, and of course there are also approaches. I have noticed that when I treat patients using our dialysis, toxopheresis, where we take blood out on one side, send it through an environmental filter, and return it purified on the other side, then the antibodies and many other things that cause the problems in people go down. And with POTS in particular, the most important thing is to reduce inflammatory substances, which we have, of course, analyzed beforehand. So I just asked, what is he doing in the lab? Then you look at the blood rate, CRP, interleukin-6, and what they're all called, or fat oxidation, which also has a damaging effect on the vessels, but also antibodies that specifically the autonomic nervous system. There are different ones that target the autonomic receptors, the keyholes of the cell, if you like, the heart, the nervous system, everywhere. And in many cases, these are elevated in these cases. And if I remove toxins with blood donation, reduce viruses, also through other measures, which then lead to a reduction in these autoantibodies, then I can see that this disease disappears relatively quickly. And that's why it's also important to chronic viral load. Some people come with hepatitis C or HIV, which is of course rarer, but many have cytomegalovirus, Epstein-Barr, and so on. You have to tackle these too, because this chronic active exposure to pathogens leads to inflammation and triggers the autonomic nervous system again. Then there are Borrelia toxins, which we also use to draw out toxins from fungi and bacteria. Many people have candida or streptococci somewhere in the nasopharynx or something like that. And in addition to their direct effect, they also release toxins. I can get all that out via apheresis, through toxopheresis, which is also an important point. I have to seal the blood-brain barrier. The blood-brain barrier is a protective mechanism. We have arteries that go from the heart up to the brain, and to prevent everything in the blood from simply entering the brain, there is a blood-brain barrier. This means that there are cells around the blood vessel that prevent everything from simply getting through. They only let what is allowed through. And this blood-brain barrier can also be measured very well in the blood. It is often open, as we know it from the intestine. Leaky gut, there it's called leaky brain. And when I do toxopheresis, I can see that things are getting better after just one treatment. I can always prove that in the blood. And when it seals off again, of course fewer toxins enter the brain and trigger processes that then also take place in the brain. And people always have environmental toxins. We always find things like benzenes, solvents, microplastics, paints, varnishes, whatever, what you accumulate in the course of your life. And I have to take these things out because they cause permanent inflammation of the nervous system, the endocrine system, and various structures.
Now another quick question. Toxopheresis, can it only penetrate the blood-brain barrier if we have this leaky brain, so to speak? Or even if the blood-brain barrier is really, let's say, healthy, closed?
So toxopheresis is a blood wash. It doesn't do anything to the blood-brain barrier, except that by detoxifying it, it ensures that the substances that damage the blood-brain barrier are reduced, and then it closes quickly. Nevertheless, the brain can detoxify. So the blood-brain barrier is closed so that nothing can get in. But the brain can detoxify, but it usually does it in a different way. Not via the blood-brain barrier, but via the glymphatic system. When you sleep at night, the glial cells that form the structure of the brain contract a little. And the fact that they contract a little creates gaps, similar to the lymphatic system. And that's why it's called the glymphatic system. And through these gaps, the brain is detoxified. Melatonin, the sleep-inducing hormone, is a key stimulant in this whole process. And that's why people always say that taking melatonin is not only good for sleeping, for falling asleep, but above all, for detoxifying the brain. Because that is a key factor that induces this, and it detoxifies the brain. But the main effect of the toxopheresis is that no unnecessary dirt gets in there. Inflammatory messengers. The blood-brain barrier tries to keep out everything that causes anger in the brain. And that is, of course, the great advantage of this therapy, that you can close it relatively quickly. Yes, and as I said, it's also important to remove dirt from the body. And when we look at the bags and see what people wash out of them, it's sometimes really frightening. There are lumps of bound toxins. That's really remarkable. And we then take toxins out, of course. You also know that mercury, aluminium are toxic to the brain. Arsenic is also a neurotoxin and a cancer-provoking poison, and many other things. As I have just said, we also lower autoimmune antibodies and circulating immune complexes. Circulating immune complexes are also an issue that is often not so well known. When a foreign substance, an antigen, enters the body, an antibody, a defense substance comes and marks this antigen, this foreign substance. And this antigen-antibody complex is recognized by the immune system, and the scavenger cells have the task of eating it up. But if this happens all the time, because there's a lot of stuff in your body that doesn't belong there, then the phagocytes will eventually get fed up. They don't grab the food and leave it lying around. And these immune complexes that are then present circulate and cause trouble, and can also play a part in this. And another important point is that when I detoxify, energy production is measurably increased again. And if the body has more energy, then of course it can also better serve the arteries and the immune cells. You need ATP, this energy carrier, in all cells to ensure their function. And if this is not produced sufficiently, which it can also measure, then it's like switching off 10 cylinders in a 12-cylinder car engine. Then it still runs on 2, and that usually doesn't work the way you want it to.
To me, it sounds like this toxopheresis. Sounds to me like it's not something you use after you've already got something, whether it's POTS or anything else. But it's actually prevention, isn't it? So before these scavenger cells are already saturated, I make sure that they are not full already.
That's absolutely right. You know what people are like. They always come to the doctor when nothing else works, even with gold implantation. People with joint problems come to me when they have grade 4 arthroses, when they need a new joint. They don't come before that, when it starts to hurt. So as a doctor, you have to do more repair than prevent. But what you say is absolutely correct. Of course, it's best to say I'm health conscious, I take precautions, and simply have an early checkup to see what's inside. Because the sooner I take all that stuff out, the less damage it can do. Haber's rule is a recognized law in the science of poisoning, which says that if I ingest a large amount of a toxic substance, for example arsenic, I'll die. Or get cancer or something, which happens quickly due to the high quantity. But if I have the same toxin in my body, and it's only there in small quantities, that happens too. It just takes years and decades. And that's why it's always better to take the stuff out early so that there aren't so many side effects. And if you then remove these toxins, the blood's ability to flow naturally improves. And if the blood flows better, then of course it can better supply the brain, the heart, everything with blood, detoxify it, and also reduce inflammation, simply because the immune cells and everything else benefits from it. And above all, what is very important for us is that we provide a therapy for such diseases that people can tolerate, so that they don't go into something afterwards with a high risk that might cause more damage. Instead, toxopheresis is a very, very well-tolerated treatment, with side effects such as a little swelling under the eyes and a little swelling of the fingers for a few hours afterwards. We tell everyone that. It's not very stressful. Some people get a bit tired and have to lie down for 2 or 3 hours, but that's all. And I have never seen any more side effects. And that's why you can do it with young people, with very old people, with people who are sometimes very ill. And it's just a tool that we've realized can help people. And I've treated some patients with POTS who were really, really affected, who were also really panicky because they said, nobody can help. As it always happens, we're the last resort, blah, blah, blah. And when you then realize that you can help people, it's not just a nice feeling for the doctor, it's also a huge help for them. Because the fear that accompanies life and the reduction in quality of life goes away relatively quickly away with something like this.
That is, of course, a great solution and yes, to work preventively in general. I'm not really into the subject of toxopheresis yet, but it sounds extremely exciting to me. I always thought, yes, you really have to be a bit older and have spent several years of your life in this world for it to be worthwhile. But if I can ask you so directly, I'm 26. It would be worth it for me too, wouldn't it? So just to take a preventive look at it, how much is in there already?
Some of our patients are in their 20s or even younger, much younger patients with autoimmune diseases who are highly exposed. And when you look at how many toxins are already in younger people, including tin from clothes, color fixatives, and so on, it's quite frightening. And as an internist, you are always used to the patients coming in. We're 55, 60, 70, 80, 90, something like that. But now, more and more younger people are coming. We now have more than half of our patients under 30. And we also have a lot of children who come with autoimmune diseases, who already have Hashimoto's at the age of 4, 5, 10, 15.
Unbelievable.
And when you look and see fatigue syndrome in 20-year-olds, and you pull out stuff that you think he can't possibly accumulate, you always ask yourself, where does it come from? But it's just there. And when you take things out, yes. And that's why, of course, if someone wants to, the earlier you do it, the better. So I'm always a great friend of preventive care, but that's actually only a small proportion of patients. Most of them come when the place is on fire.
Yes, exactly. Yes, thank you very much for this interview, for your educational work, and the work you do in general.
You're very welcome. Thank you very much.
Thank you too. Yes, dear viewers, better prevention than when the house is really on fire. And I hope that you have also been able to take away a lot of information from this program about toxopheresis, about the POTS, and what exactly they are. And on that note, I wish you the very best of health and much success together.